gotten tons of texts already, and this is the subject of the day today, and it's probably going to be the subject for a while, so this is perfect timing to have Dr. Kevin Kavanagh. Dr. Kavanagh is a retired physician. He is also founder and president of a national organization called Health Watch USA. Now, if you want to get in on this discussion, either live with the doctor on the phone, or if you want to send a text, 253-5959, either way. And good morning, Dr. Kevin Kavanagh.
Good morning, Jack.
You ready for a little heat?
Well, I thought so, yes. I know what it's going to be about.
Okay, let me do this. Let me set you up here, and then I want to hear what you have to say. According to the CDC, fully vaccinated people no longer need to wear a mask nor socially distance. The director of the CDC, Dr. Rochelle Walensky, said based on the continuing downward trajectory of cases, the scientific data on the performance of our vaccines, and our understanding of how the virus spreads, she continued to state that that moment has come for those of us who are fully vaccinated. A person is considered fully vaccinated after 2 weeks from your last dose of vaccination. According to the CDC data, approximately 35% of the population is fully vaccinated. Now, here's the big question. What does Dr. Kevin Kavanagh think about it?
Well, I was kind of taken aback and very surprised. As you know, last week the CDC said the virus is aerosolized, which set up all warning flags. And this week, well, don't have to wear masks anymore. There's no problem. I'm concerned, and I agree with the governors of Massachusetts, North Carolina, and New Jersey who are keeping their indoor mask mandates. And I should point out the governor of Massachusetts is Charlie Baker, who's a Republican. This is not a partisan dispute. I'm also more in line with the thinking of Nancy Messonnier, who is the CDC expert who announced the terrible devastation that is forthcoming with the coronavirus back, last February of 2020. And she was, I think, reprimanded for that, or at least silenced. She last week announced that she was having her resignation, and that's going to be effective today. So I do think that there may be some differences of opinion regarding this. But what they need to start doing is talking about variants. The vaccine works great for the wild type of virus. It works very well if you get both doses for the UK variant, but the other variants on the horizon, there may be difficulties. And this idea of survival being the benchmark for a good public health response is not really acceptable. People can get severely sick from this disease, as we've talked about. And if you get long hauler syndrome, even if you get mildly infected, that can still be a problem. Now, I should add that with the vaccines, if you're fully vaccinated, those chances are less likely to occur. But with these variants, who knows? And that's the problem. We don't have enough data. We can look at what's happening in India, and it is scary. And having only a third of the population fully vaccinated, in my opinion, is not nearly enough. And you've got no way of monitoring who's going to be wearing a mask and who's not based upon vaccination status. We don't know who's vaccinated and who isn't. So I think that this is probably a step too far at this point. I would feel much better if this had taken place when we had a robust surveillance system for genomic sequencing to detect these variants and the variant spread in the community. And I'm talking about now the escape immunity variants. If we've had building ventilation upgraded, if Americans had ready access to and had some N95 masks at home, if the vast majority of the population had become vaccinated, and again, if we had a system where we could somehow tell who is vaccinated and who isn't. So I think that this step may have some problems. I don't feel everybody's in agreement with it. And for one, it makes me a little uncomfortable.
Here's what I think is going to happen, and Lane and I have been talking about it this morning. I think that some businesses, and they certainly will have that right, will insist on people continuing to wear masks, and I think that's going to cause problems. I think that people who choose to wear a mask in a place that doesn't require it are likely to be criticized because we know how nasty people can get, as they did when when this all started, and people being chastised for not wearing the mask, I think are going to be chastised for wearing the mask. Here's my question for you, sir. What do you think changed the CDC's tune in 24, 48 hours?
Just my opinion only, and I have to really state that this is opinion. I am very worried that they had backlash from their announcement regarding aerosolization of the virus indoors. That would mean that you'd have to have N95 masks, that would have to be geared up, that you would have to fix building ventilation. And I'm sorry, Jack, but even if I'm vaccinated, and if I go in and buy a $5 hamburger, I don't want to come back and go home and then have 1 week of sickness. Even though I didn't die and get in the hospital, I don't want to be sick for a week when that could have been avoided by having better building ventilation. I mean, this should be done anyways. And we're just moving the bar of what good public health is. We're ignoring the long-term effects of this virus, even in those that are mildly sick or have moderate sickness. And I do not think it is wise. There are many scary things about this virus that could theoretically be occurring that are not fully investigated. And when you start giving out advisements and you don't tag that with variants, in other words, vaccine from the wild type last year's virus, how well is that going to work with the Indian variant, the Brazilian variant? We really do not know. We have some lab data, but we're still largely in the dark. And we don't have a good surveillance system. We need to have that up and running. So it's kind of like, don't test, it's not a problem. Again, I think we've gone a step too far with this.
Hey, let's take one call, then we're going to take a break. Got a bunch of texts. Rob, thanks for holding. You're on.
Hey, thank you. Dr. Kavanagh, I kind of feel the same way. I'm a little nervous and a little surprised that this happened this quickly overnight. And I know that you probably don't get into the political aspect of it, but I believe that the CDC, NIH, whatever you want to call it, has political ties, whether they want to admit it or not. And there was many articles last night floating around saying the CDC's decision was utilized to take the eye off of severe issues across our country, whether it was the gasoline or Israel or the economy. And I almost have to wonder, did that have a part in it? Because I can't make any sense on why it happened the way it did.
Well, and I agree with you. I think there's something going on. Because let's face it, earlier this year, it was it's okay to have children 3 feet away from each other in school, not 6 feet. Then all of a sudden, the virus is aerosolized. Last year, we're talking about not testing of asymptomatic carriers. That was quickly reversed. We, of course, had the fiasco regarding masks. And all in all, I'm very worried that this is not going to be a good track record for overall security of our nation. And it's not also going to be a track record for reliability and dependability of government institutions. So yes, I share those concerns. I just think it's a step too far. I do think we need to open up, but we should open up safely. They apparently don't want to invest in surveillance. They don't want to invest in N95 mask preparedness, getting air filtration better. They want to declare the pandemic gone, and it's not gone. We're going to get hit with another variant of the virus.
Thank you, Rob. I appreciate the call. It's 9:49 at 97.3 FM, WVLK, and Dr. Kevin Kavanagh is our guest this morning as we all react in one way or another to the announcement by the CDC yesterday that folks, and the governor, by the way, support of the CDC's action that you can stop wearing your masks if you are fully vaccinated. Now, that begs this question, Dr. K, and this is from our auto tech service text line, and I'm glad the person asked it. He says, or she says, how do these so-called vaccine passports, or someone asking, and yes, it happened to me yesterday, and I have been vaccinated, how do they not violate HIPAA laws?
Well, because industry is not a healthcare institution. If you have a retail establishment that asks you if you're vaccinated. That's not HIPAA. HIPAA is fairly, narrow. It involves doctors, healthcare, etc. But in industry, I believe they're going to be able to require proof of vaccination, just as foreign countries will be able to do that. And foreign countries are doing that. I think, you could have a lawyer ring in on that, but as far as availability of medical information or me saying things, that's not exactly a HIPAA law violation. You don't have to provide the information to that person, but you don't have to enter their establishment either.
Right. Yeah, we talked about that earlier. And as a matter of fact, I'm glad you said that because, Lane, you looked up some information about some local businesses and if they're going to require masks or not. And what'd you find out?
Yeah, I sure did. Actually, I heard from a friend who works at Kroger saying that they weren't going to say either way, but someone just texted in and said that they saw on the TV today that Kroger's is requiring people to wear masks.
Okay.
Walmart is the same thing. For right now, Walmart is even saying we're requiring people to wear masks at this time, but everything is under, advisement.
Okay.
Well, yeah, and you need to realize that this vaccine isn't 100% effective. It's 95% effective in healthy individuals if you're immunosuppressed, and that includes people who've had transplants. There's unfortunately research that shows the vaccines may not work that well. So you're going to have a number of people, a lot of people, that are going to have to be wearing a mask. They probably should be wearing a mask anyways, and they don't need to be harassed. If they're old, they have a cane, they have a transplant, these are people that are going to have to wear masks. And I am scared of a backlash. I don't think it's correct thinking on individuals to say, oh, let's open up, everything is fine. I agree with Walmart and Kroger that they should go carefully. Certainly, you would want to have upgrades in ventilation first and more of the population vaccinated. Because even if you are vaccinated and you get one of these variants, this immune escape variant, you may not be symptomatic, but you could well spread the infection. Just take a look at what happened in the Kentucky nursing home. That was an immune escape variant, an E484K variant. So we have to be careful because if you have 2/3 of the people not fully vaccinated, one dose will not work well with these immune escape variants, and you have other people spreading the virus, that's a setup for a disaster. Remember, these variants are more infective and more deadly than the original wild-type variant last year, which is another reason to become fully vaccinated. So please do that.
Here's another text that says, have they had any trouble in Texas and Florida? No, they haven't worn masks for some time. Maybe we won't have to see Fauci on TV so often either. Have they had no problems without wearing masks in Texas and Florida?
Well, I haven't looked into that data on what's happened recently, but I can tell you that last year, around September, Texas and Florida were used as examples of achieving herd immunity and that things were going well. And of course, we had a big surge over the holidays. So I think it's a little bit too early to tell, but I do think that we still need to side on the side of caution. This is a virus where I think you need to prove that it's safe rather than we're going to go do this until you prove that it's unsafe. I think that we need to be more cautious on this.
And Lane, did you want to say anything?
Actually, it's kind of funny that you said that. Yeah, I just real quick, I want to mention again that one verse because to me, I'm seeing a lot of people who are having an issue with this are Christians, as I am myself. And I go back to, was it James 1:19 that says, everyone should be quick to listen, slow to speak, slow to become angry. Let's apply God's word. Let's have a good weekend. And
yeah, well, I think that's true. And at least be tolerant of those people who are still going to want to wear masks. I'd like to close by an op-ed that was in the Washington Post, and this was 2 weeks ago, and this was written by an Indian doctor talking about the outbreak in India, which surprisingly has all but vanished from our news. And it said, the devastating second wave in India is the result of a perfect storm, a failure to plan for a second wave, premature relaxation of public health measures, large gatherings, insufficient vaccination coverage, and newer variants, which are possibly more transmissible and potentially more severe. So that to me still applies.
Thank you, Dr. Kavanagh. We'll talk to you next week.
Thank you.